Okay.
And I can confirm that broadcast has now started and we can begin this briefing.
Thank you, Reese. I would just like to welcome you all to the Corporate Parenting Board. It's just a briefing today instead of the formal board, and I would especially like to welcome the new members, and I think you'll find it extremely interesting, and it's something we can participate in, especially if Laura, who you were going to meet in a minute, has events for us to attend, obviously online at the moment, but hopefully in the future you can visit our children's homes and communicate with some of our social workers, families and children. It's a committee that we can do a lot of work on, and I'm sure once Stuart and Laura give you the briefing, you will find it very interesting. So I'm going to pass it over to Stuart and say, if I suddenly disappear, it's because the Wi-Fi is playing up this afternoon. Thank you. Over to you, Stuart.
Thank you, Chairman. We've got some echo. Can people mute themselves, please? Right, how's that? We've got an echo. Okay, I shall press on. Me. So for those who don't know me, members, I'm Stuart Ashley. I'm the Deputy Director for Children's Services, and I'm responsible for the Children and Families branch. Our children in care sit within my service, although collectively they are everybody's responsibility. Yours in particular, as you're here as members on the Corporate Parenting Board. I'm going to walk you through a very brief presentation that will just give you the key facts about Corporate Parenting Board and corporate parenting responsibility. And I'm going to double hand that with Laura Mallinson, who is our District Manager with responsibility for children in care. And then we'll walk on through the rest of the agenda. What I would say, members, is we have arranged two separate briefings which go into much more detail around children in care and care leavers and corporate parenting. And if you're unfamiliar with the terms and the content, then I would really encourage you to take up one of those, attend one of those presentations. So that's the introduction, and I shall hand over to Laura for the first few slides. Laura.
Okay, hello everyone. My name's Laura Mallinson. Can you see the slides?
We can see them. It just needs to go full screen, Laura.
Bigger. I'm having trouble because it's splitting across to the other side. Can you still see that?
Yeah, that's perfect. Thanks, Laura.
Okay, so I'm going to take you through a very brief introduction to the Corporate Parenting Board. So essentially, a corporate parenting is to promote the best outcomes for our children in care and care leavers. So looking after and protecting children and young people is one of the most important jobs that a council does. And when a child, for whatever reason, cannot stay safely at home, it's up to us as a local authority to step in and give them that care, support and stability that they deserve. So this isn't just up to the lead member or director of children's services. We need everyone to look out for our most vulnerable children and young people, and every councillor has a role to play. Being a corporate parent means doing everything we can for every child in the council's care and every care leaver to give them the opportunities that other children get. This covers everything from keeping an eye on their progress at school, to looking after their health and well-being, to preparing them for life as independent adults and supporting them to get them to where they need to be. We want to be ambitious for the children in our care, encouraging them to dream big and take chances, even if they don't feel that's been an option to them in the past. So the role of the Corporate Parenting Board is to support and to ensure that there's support and encouragement for children to achieve in school, to support and encouragement to look after their mental health and well-being, having opportunities for positive social integration, and enabling the most vulnerable children and young people in society to flourish into successful adults that they can become. So what needs to improve? So the Corporate Parenting Board's rigour in holding partners, including health providers and district councils, to account to ensure that they prioritise services for children and young people more effectively. So in order to achieve it, a little background about how children come into care. So children in care can be aged between 0 to 18 years. and care leavers are aged 18 to 25 years of age who have been in care, and there's a set criteria and eligibility as to what level of support that they are offered. So there'll be a programme of business which will be reviewed and amended by the Corporate Parenting Board as to how we ensure that children are provided with the best care. So they'll be reviewing the outcomes for children in care and care leavers, ensure that the voice of children in care and care leavers is listened to, acted upon and incorporated into key plans, policies and strategies for children in care and care leavers, ensuring sufficient resources are available for care ambassadors to directly engage with all children in care and care leavers, and commission and deliver agreed projects on behalf of Hampshire County Council. To raise the profile of children in care and care leavers by promoting the role of elected members as corporate parents with key responsibilities, and hold partner agencies to account in respect of their responsibilities as key corporate parents. To ensure that children and young people are clear about what they can expect from the council as corporate parents. The Corporate Parent Board will meet with children in care and care leavers, frontline staff, foster carers, residential homes to enable them to inform the board of the standards of care offered to our children and young people. The focus of work will remain in line with the priorities of the Children in Care and Care Leavers Pledge and the local offer for children care leavers, which will be reviewed on an annual basis. There'll be joint working between the Corporate Parenting Board and Hampshire Safeguarding Children's Partnership, where an annual report on the Corporate Parenting Board will be shared with Hampshire Safeguarding Children's Partnership. And the Corporate Parenting Board will make recommendations to the Executive Lead Member on matters relating to children in care and care leavers. Yeah, and I think Stuart's going to pick up from here.
Okay, thank you, Laura. So how do children come into the care of Hampshire County Council or any local authority? There are two routes, basically, and I want to dispel a myth. One of those myths is that social workers remove children from their homes and bring them into care. No social worker has the authority to do that. The only person that can make a decision of a child coming into care long term is either the child's parents or the court. And those are the two routes within which children come into care. The first one, as you can see, the penultimate bullet point, is called Section 20 of the Children Act 1989, where a parent or parents will say they really can't manage the needs of their child, and therefore they are voluntarily asking for that child to be looked after by the local authority. A typical example of that might be a child with complex disabilities who needs particularly high levels of care, and we would discuss that with the parents. We would identify the right resource, and if necessary, the child would become looked after. Excuse me. That doesn't mean that we can make all the decisions for the child. If the child has come into the local authority care by voluntary agreement, the parents hold and retain parental responsibility, and so they can make key decisions about their child. Right. So they can also remove their child at any time. They don't have to give us notice. They can just take their child home, and sometimes that does happen. That would nowadays be around about 20–25% of the way that children come into care in Hampshire. The 75 to 80% come in through court orders, and this is where social workers will have tried to work with the family to keep a child safe, to improve the conditions often for the child at home, and if that has failed over a fairly lengthy period of time, then we will have issued an application to the court, provided the court with evidence, and the judge will make a decision. And if they make the decision that a care order is required, the local authority then share parental responsibility for that child, and they share it. The parents still have a right to make decisions, but ultimately the local authority can outvote that, if I can put it that way, that decision if it's in the best interest of the child. So we share parental responsibility and can make day-to-day decisions. So those are the two routes. That bottom bullet point, we have over 1,600 children in our care in Hampshire, at an average cost of £60,000. So this is a very expensive part of the council's responsibilities. Thank you, Laura. I hadn't realised you'd jumped. Could you go back, please? You'll hear us talk about unaccompanied asylum-seeking children, and you'll see from the news that children do, and it happens in Hampshire. They come off the back of lorries, and they arrive in Hampshire, and we are then responsible for them. They have no parents in the country. Then the local authority where they arrive, and if they step off the back of a lorry on the M3 services in Winchester, Hampshire's the local authority who's responsible. We then become the parents for those children. As you can see, there are currently 1,649. That's actually reduced a little bit since this data was pulled together at the end of March. And interestingly, children come into care and out of care every single day. I've just had an email about half an hour ago that said last week 14 children left care and 10 children came into care. So it's a constantly churning situation. Majority of children are cared for by foster carers, so that the children have a family life and experience a family situation. And as you can see, most of those are Hampshire County Council foster carers. But because of the numbers of children in care, we do have to commission placements from the independent sector. Wherever possible, though, we look to provide in-house foster carers, because actually we know the quality of those foster carers. That's not to say that we have concerns about the independent sector. It's just that it's more economical and closer to home if we can place children with our Hampshire carers. We have a duty to look at extended family members and friends of the child. If the child needs to come into care, why wouldn't we work with grandparents, uncles and aunts to see if they can care for the child? You can see that we have 193 children placed in children's homes. We have our own in-house children's homes, which you'll be able to visit over the coming months and years. And again, we do commission through the independent sector. And then we have around about 120 children who are placed with their parents. So something of an anomaly with the law, to my mind. A recent judicial review has said in future we shouldn't see this happen. But at the moment, we have children that we take the evidence to court, we ask for a care order to remove the child from home, and the judge gives a care order. So we share parental responsibility, but the child stays at home. It's a difficult position for us to be in, because we can't oversee that child's care 24 hours a day. It's simply not possible if they're placed at home. Over the coming years, that should start to reduce, given the recent review that I referenced. And I've talked about the costs. And then when our children in care reach 18, they become known as care leavers. From the age of 16, we will allocate them a personal advisor, and they will work alongside the social worker, getting to know the child, getting them ready, thinking about what happens as you enter adulthood. Some of our children will stay put, so they will stay in their foster homes, because actually that's normal and that's what happens. Not every child leaves home on their 18th birthday, nor should they. Some of our care leavers will go on to university, but we will support them up until the age of 25. And that support can take a variety of different ways. It can be just advice. It can be much more than that. It can be financial support. The whole raft of parental responsibilities that you would assume with an 18 to 25-year-old. Thank you, Laura. So, members, that was a real whistle-stop tour. In essence, you now have an extended family of circa 2,300 children and young people, as we all do. And I think that's a really, not only is it an important responsibility, I think it's an exciting opportunity. So that's, as I said, a whistle-stop tour of children in care, the corporate parenting responsibilities. And I'm happy if there are any questions in respect to that. Thank you, Chairman.
A hand has been raised by Councillor Hare, Stuart.
Yes, Councillor Hare.
Thank you. That's a really comprehensive report that was on our iPads anyway. But a couple of questions. If a child is looked after by extended family, and the family is sort of on fairly low income anyway, so do we support them financially and for their well-being too? That's one of my questions. And the other one, was about the £60,000 per child. Is that the cost to the authority, whether they're in foster care or in-house or out-of-house care?
Okay, so first question, do we support, if they're looked after by family members, do we support them? Yes, We would undertake an assessment to make sure that the relatives or friends could meet the needs of the child, and we would also then potentially take them through an approval process as connected carers, which is a formal phrase, and they would be entitled to support. That support is means tested. In some instances, it depends on the regulations under which we support the child and the family. One of the issues that I am promoting is it's okay for close family to look after children. It's legal. We will support them in any way we can, but the child doesn't necessarily need to come into care as part of that, because actually that's just what family do. But sometimes they do need to come into care, and then we will approve those carers as foster carers, but they're known as connected carers. And in answer to the second question, the £60,000 is an average price. So some placements cost less than that. Some cost exceptionally more than that. So, for example, if we have a child who is required to be in a secure unit, the costs can be to £300,000 a year and upwards at times. So the expensive end is very expensive. There are lower cost options, but the average is about £60,000 a year. I hope that answers it, Councillor Hare.
Thank you. Yeah, that's great. Yeah, I was just interested more about the family, extended family, because where the child feels wanted and accepted, and it's different from actually going into care.
Yes, you're absolutely right, and we would always promote that. Legally, we have a responsibility to look to extended family in the first instance. That's actually in the Children's Act 1989. It's part of the regulations that say we should, in our first instance, we should seek for a child to be cared for within their extended family. Councillor Adams-King.
Sorry, Stuart. I should, I suppose, repeat my declaration of interest, which you've heard before, but I guess Laura perhaps hasn't, which is that I'm an adoptive parent, and I also chair the adoption panel for Aspire, which is our neighbouring adoption agency that covers BCP and Dorset. And I just wanted to carry on that theme, really, because I was quite interested reading a report about the fact that you're setting up a separate SGO, a special guardianship scheme, and as Pal was saying, that offers a quite efficient way into caring, and I didn't know how that was going, and whether you were going to offer whether there was a thought of offering support for people there. And is it an issue at the moment that there isn't a separate department for doing, or isn't a separate team for doing that, and as such we're perhaps missing out on the opportunity of placing children with extended family because of lack of capacity to assess people, and consequently they're in foster care? Or is it just that you're identifying a need to have a separate support system for them?
I can see Sarah Plummer's got her hand up, and she's done a lot of work in this area. So I'll just say a little bit, then I'll hand over to Sarah. It's not a lack of capacity. I think it's about a changing emphasis for the service, and making sure that we're looking at all possible options. But Sarah, did you want to come in to bring your expertise into this?
Well, just to say, we've got a presentation later on today about family and friends care specifically, and setting up the new family connection service, so I can talk about that a bit further, and that might answer some of your questions then. Okay,
thank you. And my own view, it's not about capacity. I do think it's about mindset and thinking slightly differently. Care can often be a safer option when actually we need to challenge our thinking about, how can we support children differently. Thank you.
I see no other hands raised. Before we move on to the next point, could I just ask that we, almost as a point of order, even though this briefing has no formal decision-making powers, if we could just note the minutes of a previous meeting, if that would be possible. Chairman Briggs? I believe you're muted, Councillor. You're unmuted now.
right. We know that Councillor Briggs is having some technical problems.
Yes.
Today.
Could Councillor, if Councillor Phil, Councillor North, could you possibly see your hand raised there?
I'm here, Reece. So I'm more than happy to do that. I was actually going to raise a point in the minutes, and sorry, I was having some technical difficulties getting onto the meeting as well, which is why I thought you'd already passed the minutes. But on page 5 of the minutes, there's a bullet in relation to care leavers and in relation to council tax exemptions. I know there was 3 district authorities in Hampshire that don't currently give the tax exemption, and there was a resolution to write to all of the leaders of district councils anyway, and not just about that, but in relation to wider care leavers report. I have to say, I don't recall receiving that, so I just wanted to check if that indeed had been sent, and whether there'd been any change in policy in relation to Hart, Rushmore or Gosport as a result of the email or communication, if indeed it had been sent.
Just to clarify, was that asked to me there, Council, or was that asked to Stuart?
Anyone that has the answer.
I'm happy to answer. I think there's an echo again, so I might need to ask people to mute, please. In answer to the question, we have written on several occasions, Councillor North, over the last few years, and we've seen this gradual shift where district and borough councils have moved and changed their policy. We deliberately held back on this letter, awaiting the elections and the formation of the new corporate parenting board. Now that we have you in situ, I'm very happy for that letter to go out, and it can go out from the chairman, Councillor Briggs, or indeed officers, but it will go out now. Thank you.
Perfect, thank you. I think Councillor Briggs did actually come off mute for a second, so if she sorted her technical difficulties, she probably can take us through this now, rather than me stepping in. Thank you. Thanks. She's shaking her head, and she's back on mute again. So
yeah, I believe we're just gonna cut in out of meeting. I'm afraid. Does anyone else have any concerns with the previous meetings? Sorry, just to cut in back, Councillor.
Sorry, I thought you wanted me to ask people if they've got any objections to the minutes. If not, we'll note them and take them as read.
I think that's the perfect way of putting it there, Councillor.
Fine. Well, I don't see any hands raised or hear any objections, so we'll take it that they are noted.
Thank you so much, Councillor. If we can turn back to you now, Stuart, and I think it's time to move on to the next item.
Yes, thank you. The next item, sorry, I'm just bringing up the papers again. The next item is Tim Sandel, who is the partnership manager for the Hampshire Safeguarding Children's Partnership. He will talk to this. It is a technical item, this. We're required under working together to have an agreement between the Hampshire Safeguarding Children's Partnership, which is the 3 lead agencies, the local authority, the police, and the CCG, who are responsible for all services related to children's safeguarding. And there needs to be a protocol between that partnership and the corporate parenting board. And Tim will just talk to you through this, what is in effect a brief protocol. Tim, over to you, please.
Thanks, Stuart. Chairman, members, good afternoon. So I want to update you on the protocol on the working arrangements between Hampshire Corporate Parenting Board and the Hampshire Safeguarding Children's Partnership. The protocol has been amended to reflect the new status of the Corporate Parenting Board. So the Hampshire Safeguarding Children's Partnership and Hampshire Corporate Parenting Board are equal partners with a joint responsibility to ensure that the needs of looked after children are prioritised at a strategic level and delivered effectively at an operational level. So this protocol will support the Hampshire Safeguarding Children's Partnership and the Hampshire Corporate Parenting Board to operate effectively in relation to one another in terms of safeguarding and the means to secure effective coordination on matters relating to safeguarding of looked after children and care leavers. The Hampshire Corporate Parenting Board produces an annual report, and this will be submitted to the Hampshire Safeguarding Children's Partnership, and the Hampshire Safeguarding Children's Partnership also produces an annual report which will equally be presented to the Corporate Parenting Board for relevant matters relating to looked after children and care leavers. Quality assurance audits undertaken and commissioned by the Hampshire Safeguarding Children's Partnership in relation to any aspect of looked after children issues will have the findings reported back to the Corporate Parenting Board in a timely manner. And just to conclude, so this protocol has been reviewed and amended, brings it up to date, and is presented for the board to recognise and approve today. Thank you.
I assume that Councillor Briggs hasn't got over her technical difficulties, so I'll ask if anyone's got any comment to make on that. I suppose my only question is, now we are doing this on a Teams meeting rather than in person. Presumably this has to be an item on our next agenda as well to formally agree, does it?
That would, well, certainly a lot of these items are merely to note in the first place, Councillor. In regards to going back to formal approval, only the minutes that we just noted would formally have to be approved at a future meeting.
Okay.
Stuart,
so
if you want to cut in and just add.
When I looked at the report pack, and apologies, I'm just sort of thrown in a little bit at the deep end because I wasn't consulted to move this meeting online, but I wouldn't have expected to be so. I mean, I assume that the chairman made that call, but this does say that it is a decision report, which is why I asked the question that it needs to be formally ratified at our next meeting.
And it's a very fine question to ask, Councillor. In regards to the decision to move it to virtual briefing, about a decision taken with our legal team and by the Democratic Services staff, including me, and it was simply a matter of public health and also due to the current COVID restrictions. So that was a decision taken by us, and it was a decision taken because we're satisfied legally that there are no, despite the decision mentioned in the wording, that there's no legal decision to be undertaken, if that makes sense.
Fine. Okay. Well, I suppose I will ask then if there is any objections to the protocol. I can't see any hands up or any voices raised. So that being the case, I think we can move on, and I'll call item 5 then, which is the annual report for children in care. Who's leading on this one?
Well,
Myself.
That will be Laura, Councillor North, and I've just introduced this item as I have the others. I think this is a very helpful report. There's some additional speakers that will come in as well with some additional work that we've been doing around health assessments and SGO, special guardianship orders, etc. So this will give members a good overview of activity in relation to children in care. And Laura's going to start.
Thank you. Okay, so in terms of the report, I've stated on here in terms of the priority areas for children's services around children in care, and that has been around improving the timeliness of health assessments, increasing the number of children who can safely be reunified to the care of their family, increase the number of children who are cared for by family and friends via special guardianship orders, and have a greater understanding on the emotional well-being needs of children in care and ensuring timely access to support. And just in terms of, you heard it through the presentation, but children in care of the local authority are one of the most vulnerable groups in society. It's vital that the care we provide to children in care is of the highest standard, and that everyone involved in supporting and providing this care is aspirational for all of our children. So children in care of the local authority is any child, young person between the age of 0 to 18. You heard that in the earlier presentation. And they have to have been in care of the local authority for more than 24 hours. Again, you heard this in the earlier briefing, so I'll quickly go over. So children can become looked after because of a voluntary agreement by their parents or because of a care order made by the court. Young people between the ages of 16 and 18 years old can provide their own consent to come into care and do not require the agreement from those with parental responsibility, such as their parents. A significant change in practice has meant that children in care are in care for as long as needed, opposed to previous practice, which saw a child's plan being made for long-term care, meaning that this was the plan until they reached the age of 18. This is reflected for the changing needs of children and their families, and in recognition of the importance of family life and living at home as being the right place for children and young people if it's safe for them to be there. I won't go into detail because you've all seen the report, but I thought it was important to put a little bit about Hampshire demographics, because whilst the children in care they are the same as other children in the respect of the priority areas for that. But just to highlight, over 1/3 of looked after children are affected by poor emotional well-being. Increasing numbers of children have complex health and social care needs, and children in care are less likely to be up to date with their immunisations. And so moving on, I've added a lot about the data for children in care. So as of the 31st of March, Hampshire had 1,649 children in care, that being 0.51% of Hampshire's population of children. So there's a chart there. So the chart above reflects that the greatest proportion of children in care are between the age of 10 to 15 years old, with significantly more males than females. And with regards to the main placement, it's positive to note that most children in care are placed with foster care, with just over 50% being placed with Hampshire carers. So that's what we've got in terms of those that are new to the board in terms of the terminology. We have currently got 482 children with in-house foster carers and 463 with the independent fostering agency. What is also significant to note is the number of children placed with parents, which again you heard earlier. So we've currently got 126 children, which means that there's 126 children who are subject to a care order, but in their parents' care. And there's further information regarding this within our reunification section, which is further in my report. It's of interest to note that 256 children are placed with family members or friends who have been approved as connected carers. So again, Sarah will talk about that in the Gateway to Care presentation in a minute, about how we're setting our plans to reduce the number of children in care, but to continue to support these connected carers under an alternative legal order, such as a special guardianship order. So moving on to how long children are in care. So most children are in care for over 5 years, with 24% of children. The least number of children are in care between 2 to 3 years at 12%. Within 12 months of being in care, 28% of children exit the system. And it would be interesting to note with our change around the support to the connected carers and the family connections team, if we start to see changes in that data over the next 12 months. So placement stability. The stability of children in care over the last 12 months reflects that positively most children remain in the same placement. 1,115 children, that is, with a very small number of 38 having had 5 placement moves over the year. And they are generally our most complex young people. So Stuart mentioned around the legal orders for children in care in the presentation earlier, with 77% being subject to a care order and 17% being subject to Section 20, which is the parent's consent. In terms of unaccompanied asylum-seeking children, Hampshire currently have 56 unaccompanied asylum-seeking children. 5 are female and 51 of those are male. Disabled children, we currently have 603 children open to the Disabled Children's Team, of which 56 of those children are in care. 30 of them are subject to interim or care orders. So the remaining 26 are in care with parental agreement. A little bit of information around how we support children in care. So Hampshire have got 6 children in care teams. Each one has a team manager and an assistant team manager, and on average 9 social workers within each of those teams. The average caseload for a child in care social worker is 19 for a full-time worker. Children move into the children in care team where there is a plan for what we call, the terminology is used as permanence. So whereby it's clear that children at that time need to remain in care. For those children who there's a plan for to return to parents within 12 months, they will remain in what we call our children assessment and safeguarding teams, also known as the CAS teams. I've added on here a little bit about our outcome-based placement team. So this is a specific team who are focused on a specific sport, who look to move children to ensure that they are in the right type of placement to meet their needs. And in order for them to do that, we use a specific support needs assessment to ensure that progression is made throughout the course of the placement and that there are clear plans in place which will support to identify their longer term care needs. So over the last year, the team has supported 18 children to transition from residential placements to either post-16 accommodation or foster care. And there was an addition of 7 young people who were returned to their family from residential care over that same period of time. I mentioned earlier, and there'll be a little bit more around reunification. So Hampshire introduced the Hampshire approach as a methodology of our intervention in 2018. With that, we were focusing on a strengths-based approach, building positive relationships with families, identifying strengths and using this to support areas of change. For children in care, this has had a significant impact around their plans, and that, as I've mentioned already, that children are in care as long as needed. So a recognition that the family situation can change. There's been significant progress around working with children and their families to enable children to be safely reunified to the care of their family over time. And we use this using a toolkit which has been written and supported by the NSPCC. Hampshire saw 355 children reunified to the care of their parents in 2020-2021, and we aim to increase to see 400 children return to the care of their parents for this next year. Spoken around special guardianships orders, so it's recognised that children who remain placed with their family or with friends do better. We continue to remain within their family environment where their sense of belonging is maintained within the family. There's currently 256 children who remain with their wider family or friends. So in terms of Sarah's presentation, she will talk to us around the Gateway to Care, and we will be looking at supporting alternative ways that children can remain with those family and friends. And one of them is using a special guardianship order. And in 2020-2021, 79 children who had been in care for more than 12 months stopped being looked after as their carers became special guardians. I've gone on, there's an awful lot reported around children in care who go missing. And it is vital that we know the whereabouts of all children in care. And we closely track that because we know that children in care are at increased risk from child exploitation. We know that exploitation includes child sexual exploitation, child criminal exploitation, modern slavery, trafficking, and county lines. We have a close working relationship with our Willow and Met police within the team. We work with young people at risk of exploitation, and this work is also supported by the local Safeguarding Children's Partnership. We have a need for all agencies to work together around exploitation and ensure that there's an effective response to the changing needs within the county. We understand for children in care who go missing, we ensure that they are offered a return from missing conversation to understand where they have been at those times of absences. Within my report, I have listed various operations that are in place and strategies that we use to understand and monitor and intervene for where children are at risk of exploitation. At section 19, I've spoken about children's wishes and views. So as part of the Hampshire approach, we revise all our recording in relation to children. So all our visits, assessments and plans are written to the child using strengths-based language that's appropriate to their understanding. Children are involved in the developing of their own care plans. They can do this directly with the social worker or even write it themselves. Since we've implemented these changes, we've seen an improvement in the engagement of children around their care plans, and they feel very much part of it, with 94.9% of children who have participated in their review meeting in March 2021. In terms of us understanding the needs of children in care, I've listed within the report about some research that we're working with, that we're involved in from other universities. So we've got an evidence-based research programme, which you've heard previously through the Modernising Placement Programme report. We've linked in with the Bristol University and participating in a research study into the long-term mental health of children in care in England. That research has got some funding extended. So initially we thought we'd only have one wave of results. The funding will enable us to have 3 periods in which we can gather that research directly from young people. So within the first wave, we had 150 completed surveys from Hampshire, and the second wave questionnaires are currently being distributed now. The virtual school have linked in and are participating in research with the University of Oxford and the Department of Education on shared training and assessment of wellbeing. So that was within the virtual school. We'll bring able to talk more about that in their reports. The Voice of the Family is a research programme that the Rees Centre and the Department of Education and University of Oxford are undertaking with Hampshire families to understand their experience of working with Hampshire and having a child removed from their care. This is a recognition. This research has never been done before. We haven't got the research about the family's experience. This is a really important piece of work. We have a Bright Spot survey, which is a national survey run by the charity Quorum Voice. It collates the voice of the child and their experience in care. So this is a biannual survey, which we've had it postponed due to COVID, but we'll be doing it this year. But we've just had the evaluation published, which highlighted the positive responses from children feeling bullied in school, and also a production of a video by children in care about their experience. That evaluation has also reflected on the change of care plans for children in care as being positive. I've gone on to talk about participation. So in terms of care ambassadors being involved in activities, we've had 67 engagement sessions. There's been county activities, there's 139 activities taking place, and district engagement events, so 482 young people participate in them. I've listed some more ways in which there's been some participation of children and young people through the last 12 months. And I've gone on just to some different ways in which we've had to work due to COVID. So we've had to obviously go virtual. In terms of at the start of lockdown, the department were very clear that children in care, foster carers and residential homes was one of the key areas of focus for the department. And we ensured that that support and staff were available to support that area of the business. Family time is reviewed, and in line with government guidance, this had to be adapted to be virtual contact opposed to in-person contact. And on the whole, families were very appreciative that they could still see their children in care. And on the whole, everyone has been extremely accommodating and understanding. Hampshire schools have remained open to all children in care. Some took this offer up, and others, the decision was made by the carers and the young people, and in consultation with the social worker, to remain at home. So just in conclusion, the last 12 months has been extremely busy for children in care. Work's been completed through the unprecedented times with children continuing to be seen. We've got a proactive transformation programme for children in care. We've had the introduction of the Hampshire approach and the strength-based work, and seeing the shift and from children in care to be in care just as long as needed. The recording and development of children's plan has been significant to really make children feel part of what's going on for them and have their voices heard. We've been engaged in a significant project on the health of children in care, which Ashley's going to do a presentation, and then you've got the children looked after nurse also give us a report on the progress there. And then I'm going to hand over to Sarah, who's going to talk more about the Gateway to Care project. Unless you all wanted to take some questions before Sarah did that part.
Chairman, might I suggest that we pause at this point for questions, because the next one is a slightly different project. It's an update. It's an adjunct to this report, but this might be a place to stop.
Thank you. Yeah, I was just about to call for questions, and I see there's one hand up already. So, Councillor Wade, you have the floor.
Thank you, Chairman. Yeah, due to a problem with ModGov, never got sight of this document, this report, until today. So forgive me for raising this, but
I think we had a similar problem last night because it seemed to be offline, didn't it?
Yeah, this report's got recommendations in it, which require a decision. Is this going to the scrutiny, the young children and young people's scrutiny panel? Because if it's not, I don't see, and as we can't make a decision, because some of these are quite important recommendations, these should actually have gone to a live meeting, shouldn't they? That's my first question.
Well, can we just get a response on that then, Councillor Wade? Because I think that feeds into the question that I had a couple of items ago, and that was that it wasn't actually a legal decision. So can we have a legal or officer opinion on that, please?
If you would like, if I understand where we're going with that question, if you'd like an opinion of a legal officer, I'm perfectly happy to consult one now and get a reply back to you, Councillor Wade, either at this meeting or afterwards. If in return to the here and now and the current briefing, the decision was made between Democratic Services in heavy consultation with the legal team that this was fine to go ahead as a briefing, given that it was their judgment by the legal team that there were no legal decisions to be made whatsoever. So that was the decision that was made on that basis. But if you would like a detailed breakdown by legal, I'm perfectly happy to get in contact with the councillor and get a reply back to you.
Well, Chairman, I just like to understand why it's got recommendations in. That was all. Because that means somebody's got to make a decision.
Okay, Councillor Wade, Steve's got his hand up, so I think he can help us out here.
Apologies for this. It's to do with obviously the change in or the extension of restrictions from the 21st of July, and I think we'd hoped and anticipated that we'd be in real life, as the kids say, and unfortunately we're not. What that means is, as Reece said, is that technically we can't take any decisions over a virtual meeting. My understanding, and Stuart, you can correct me if I'm wrong, is that none of the decisions, inverted commas, are business critical at this stage, and I think we can bring them back to a subsequent meeting. Is that okay with you, Stuart? You're nodding there. Yeah.
These are we were seeking, I think it might be fair to say, endorsement of the direction of travel from the Corporate Parenting Board, but I think we can certainly bring them back to the next one for any further decisions.
What I suggest is we might do a very brief paper that says at the last meeting we considered these matters and decision was deferred until an in real life meeting, and these are the decisions. Can you or the recommendations? Can you endorse those decisions? And then we've got it, and that will take us forward. But none of them are going to stop us from doing our business on a daily basis. If that's okay with members, that feels like the most pragmatic response.
Absolutely, that sounds a perfect way ahead. So, Councillor Wade, do you want to take the floor again and ask your other questions? Yeah,
I've got a second question. Well, thank you for that. And it was a very good report, by the way. You know, no qualms about that. But particularly as there's a lot of new councillors here. In the agenda, we have two things under this item. We've got the report you've given, which is an item in its own, and then we've got the transfer report of social care, which is the next one. I would have thought that should actually have been a separate agenda item. So I'm sorry to sound so critical today, but I only saw this morning, and you know, I just think there's two items here which should be done individually as two items rather than clumped together. That's a point, Chairman.
If I might respond, Chairman, I mean, I'll take the criticism, Malcolm, and duly noted for next time. I think remembering, and this goes back to what Ofsted said, the purpose of this board for members is to hold officers, yes, but partner agencies to account. We tried to clump, if I can use that phrase, children's services items together so that there was also items from partners, because it's that aspect that we particularly need to focus on as well. But I'll duly noted for next time.
All right, thank you, Stuart. Okay.
Councillor North, you're currently muted.
Sorry, I double tapped. Do you have any other points, Councillor Wade, or is that it?
And no, thank you, Chairman.
Okay. Councillor Carpenter?
Thank you, Councillor North. I was going to just ask Laura, thank you for your report, Laura. You spoke early on in your report about the numbers of social workers we have in the teams and all this. When I visited one of the places I went to in the last term, if you like, one of the things that one of the social workers said that they had a lot of cases. They still felt they had maybe too many cases. I just wondered what your comment was on that still, and also I just wondered what the stability, because another comment that came up was about the stability of social workers. We had quite a high turnover at one particular care home, the high security one, and I just wondered whether that had settled down a little bit.
Do you want me to go, Laura? Perhaps you could.
Yeah.
In terms of caseloads, and I mean this with the greatest respect to my social workers, it's a bit like income tax. Caseloads are always too high, and that's just a reality. It's a proxy measure. The director and myself look at all caseloads, individual caseloads on a fortnightly basis. Caseloads in Hampshire are generally the lowest they've been actually across the board. I say generally because we have been seeing a spike in demand for several months because of COVID, but we do manage caseloads very tightly actually, because it's important that our social workers have enough space to deliver proper interventions, and we brought additional social workers in as a result of that bulge of work because of COVID. But I think it's always something that needs to be managed on a weekly basis. And the second question was around Swanwick Lodge, and yes, there's been a large improvement plan put in place. We have lost a lot of staff last year. We've recruited a lot as well, and in fact our occupancy rate is now the highest it's been for several years, reflecting that we've got the additional staffing in place. And of course, what I would say for members who don't know our secure unit, it is an exceptional environment to work in because of its very nature. It's got some of the most highest risk young people, risk to themselves in the main, and it's a unique environment in Hampshire, so it's not without its challenges.
Thank you very much, Stuart. I think it's, like I said, even in lockdown, I had a virtual tour of Swanwick, and it'd be good actually. I was thinking to arrange some online tours if we're not going to be able to get out there, maybe quite as much still. I don't know. Hopefully we can. But even not, we certainly can't visit in big groups probably, as we may have done in the past, or even small groups. It might be worth thinking about some online tours because it worked. Going to Swanwick online. Okay,
well, I'm very happy to add an online tour to Laura's work programme, and I do hope that post-July we'll be able to get back to members going out and seeing places face-to-face and in person.
Thank you very much. Councillor Hare?
Thank you, Councillor North. Thank you for the report, Laura. It's really, really good and very detailed. I have concerns on a statistic that you've given. It's on page 28 and it's page 4 of the report, and it's about the emotional well-being of children and young people. The rates in Hampshire are higher for children 10 to 24 for self-harm and the hospitalisation. Compared to national statistics, and I did try and go into the link that you provided, and I'm not sure whether the link only goes up to 2018, but have we done an investigation as to the root cause for this higher rates in Hampshire rather than compared to the national rates?
That data, if I'm looking at the right stuff, so that was reference from public health, that section 5 of Hampshire demographics, is that where you're referring to? So in terms of the actual data, that wasn't my data, that I've taken that from public health, so I'm unable to explain that further. Unfortunately, our last corporate parenting board, you had the report from CAMS, who would have been able to answer those questions.
if I might come in just to support that, I think what we know, there's no known reason why children in Hampshire would be more, shall we say, or less resilient emotionally. But I think what it does say is that we know our children in Hampshire, and that services, particularly CAMHS, have invested significantly in the last 12 months in services to address this very issue. And we did hear about that at the last Corporate Parenting Board, particularly the lower level emotional stroke mental health issues. That's where the additional funding that CAMHS have received is due to be invested to commission those services to address this very need. So I think you're right to raise it. As to the root cause, I don't think I'd be an expert in answering it, but I think CAMHS have certainly stepped up in terms of wanting to address that gap.
Councillor Hare, do you want to come back on that?
Thank you. Yes, yeah, I was just concerned about why the self-harm is much higher in Hampshire. So yeah, thank you. I'll have another look at the previous reports.
I was going to raise that this point as well, but presumably those figures are in relation to the population, the population of children in the whole of Hampshire, rather than looked after children. I don't know if we've got any figures on the looked after element compared to look after children elsewhere in the country, considering that potentially is our remit. But the other point I was going to make is, considering that Hampshire are ahead on many of the other metrics in the report, but not in that one, and that one is quite concerning, considering the amount of people that are self-harming compared to the national average. Whether then that's drawn out in any of the recommendations in the front of the report, and how we're going to potentially address that. Bearing in mind, I know what you say about it potentially being addressed at the last meeting, which, of course, I wasn't an elected member. I wasn't at that meeting.
My response to that, Chairman, will be to say I think we need to revisit that data to make sure it's representative of looked after children, rather than being Hampshire children, as you quite rightly pointed out. Because from my perspective, yes, of course, we see children who self-harm who are in the care of the local authority, but we haven't seen a huge spike in that. And I think we need to qualify that data. What I'm wondering is whether it would be more helpful to have an additional report that looked at the emotional well-being and mental health of children in care with some comparative data, so that made it clearer.
I think that would be helpful, but considering that that there is some concern about that, potentially we can put that as an action in the minutes. Councillor Adams-King, have you got a point to raise on this issue, or is it separate item?
Yeah, no, this follows on as well, actually, from both of those. And forgive me, Stuart and Laura, for not being here equally last time around. But if I put on another hat that I used to wear, I stopped being a non-exec with the CCG partnership in April, just before I was elected. And having chaired their quality committee for a while, I know that there were some significant problems with the capacity in CAMHS. Because are the Sussex Partnership still providing CAMHS? Yes, are they still the provider? Yeah. So obviously that you were, well, the system in general was trying to put more funding into the Sussex Partnership to provide additional capacity. How's that gone? Is that working? So I haven't heard anything about it from a health perspective for about 9 to 12 months since before COVID. So I wonder if that's working, and whether obviously there was an issue with CAMHS which we knew about a couple of years ago, and has that now begun to improve, or is it something that we still need to come back and look at, do you think?
My perspective, it's interesting, isn't it? Because actually, if you look at Sussex Partnership Trust, they're performing very well nationally. If you look at the benchmark data, they are a strong provider. Yes, there are capacity issues. I'm speaking from a children's services perspective here, because clearly I'm not the CCG or CAMHS. But yes, there are capacity issues, and some children do wait longer than anybody would like for a service. Looked after children are prioritised. So that's important for this corporate parenting board to understand. And in addition to that, we have a very small number of CAMS practitioners within our social work teams, which mean that we can be very responsive to particular issues. One of the things that I think we've learnt over the last year with the pandemic is that it's everybody's responsibility to help support and improve the emotional resilience and well-being of children in care. Much as I've seen, we've had talent shows being done online, a whole range of things that social workers have done. But that's not to say that there's not more work. When CAMS came to the last corporate parenting board, they openly acknowledged that some children in Hampshire are waiting too long for a service. You can see Steve has got his hand up, so I'll be quiet at this point.
Well, only to say that even though we had CAMS focus on a recent corporate parenting board, there is absolutely no reason why you can't ask them to attend again in the very near future, particularly as you've got a relatively new group. And arguably CAMS should be here on most occasions. I would have no problem if you were to ask for a further update from. I would suggest, if I may, that it might be a joint update from both the CCG and the Provider Trust on how they're doing in relation to children in care.
I don't want to speak for the chairman, but if she could nod her head if she's in agreement with that, then we'll make sure that it's on the agenda for the future meeting. She is nodding her head, so we'll get that sorted. Has anyone got any further questions on this specific report? And sorry, Councillor Wade, yeah, I've seen you got your hand up.
Just a quick one, Councillor North. If CAMS are coming back to this committee, are they still going to do the annual report back to the Children's Select Committee? Because that's where they are officially held to task, that's all. Because we really need to keep on top of them and the issues that they've done.
Yes.
Thank you.
The phrase "toes to fire" is one that's coming to mind.
Great, thank you. OK, so Stuart, do we need to, well, not officially vote on the recommendations, but we can't. I take it we've got tacit support of the committee to go forward with the recommendations unless there's any objections. But also we need to do the second part of this item, don't we, and hear the next presentation. So let's do that now.
Good afternoon, everyone. I'm Sarah Plummer and I work in the Transforming Social Care programme within the Children and Families branch. Can everyone see the presentation that's up on the screen?
We can.
Brilliant.
Yep.
Right. I'm going to be giving you an overview of 3 projects that we've been working on over the last 18 months. Judging on the conversation we've had so far this afternoon, I'm going to leave more time for that middle project, Family and Friends Care, and I'll skip through the first one very briefly. As we mentioned, we've referred to these projects as the Gateway to Care projects, and that's because it focuses on a period of time in which children come into or come home from care. So the first project that I'm going to talk about is family meetings and plans. So this is the planning document that we use with families before a child comes into care, and the care plans that we use with children once they come into care. On the left-hand side, you'll see a series of statements, and that's our Hampshire approach mindset. So this is our practice framework for working with families and children, and this is the philosophy that we want to instill, the way that we want to work with all of our families and children. So what we're now doing is taking that mindset and applying it to everything that we do. So we're applying it to all of our different documents, templates, ways of working. And this project was about applying this mindset to our planning work. We also wanted to move towards this idea of one plan. So no matter where a family is being supported within our service, so whether that's in early help or child protection planning, that they have one plan that they're working towards and they feel that we've got one way of working with them. So it doesn't feel disjointed just because they happen to be moving from one team to another. We're always wanting to continue improving the way that we work, and we also wanted to learn from more virtual ways of working during COVID. So that's why we looked at this project at the beginning of last year. And by the end of the project, we created a new family meeting model, given our practitioners more guidance, support, tools and templates to work in this way. So what we did, it was just before lockdown last year. So we were fortunate enough to have 3 days with 30 attendees from across the service, where we worked together to redesign our forms. As you'll see, we created a family plan document, which had previously been 3 completely different types of template, and we created one now family plan. So no matter where a family is supported in the service, whether they move from one team to another because their cases become more or less serious, more or less support required, they have that same family plan. Similarly, for children who are in care, they have what's called a care plan that they've named My Life, My Future plan. And if they go on to become a care leaver, they retain that same plan and it evolves as they become older. As Laura mentioned, the feedback from young people has been really positive about the changes to the care plan, and similarly for families, we're seeing a lot more engagement in those family plans because they are written for and with the family, for and with the child. So they have a lot more ownership of the document, the idea being that those plans are then more likely to be achieved and hopefully sustained. So that's the reason for doing work. As I said, we brought 30 people together to design these documents, and they went back to their teams to gather feedback from their teams, from families and from young people. We tested those documents over last summer, and the forms were launched in July with a series of follow-on workshops for training. So this is an important piece of the puzzle because it really lays the foundation of the work that we then do with the family or that we're doing with and around the child. So that was our family meetings and plans project. But I'll come on more to talk about family and friends care, since we touched on this earlier. So this was a broad project thinking about our routes into care. So as Stuart mentioned, there's different ways in which a child could come to live with their wider family network. It could be through a special guardianship, or it could be that we require that family carer to become a foster carer, to be registered as a foster carer. And what that means is, to all intents and purposes, the child is living in care. They still have to have care plans, they still have to see a social worker, they still have to have health assessments and education reviews. So a lot of things come with being placed with a family carer who has to be a foster carer. Likewise, that carer still has to see a supervising social worker and get the support that any other stranger foster carer would do. And that's why, wherever possible and where it's appropriate for the child, we would look for them to be placed outside of the care system. So that might be under a special guardianship, or it might be in a more informal arrangement. So the things that we've been looking at is our routes into care. So making sure our processes are really efficient and working in the right way so that the child is placed in the right type of placement for them. We also looked at our packages of support for carers, so to make sure that the carers were getting the right level of support and the right preparation to take on this role. So that was something that we found we needed to improve, was helping carers to prepare to take on what could be a massively life-changing decision to take on the long-term care of a family member's child. We've made updates to our assessments and plans, and we want to update the support and guidance that we provide to these carers on a long-term basis. The last piece of the puzzle was looking at our teams and structures and ways of working. So we had previously had assessor roles spread across our districts. We've now brought them together under a family connection service with a new team manager being recruited at the moment to lead that service. So that's a summary of the changes that we made, and those recommendations were approved by our management team at the end of March. So we're in a transition phase setting up that family connection service at the moment. This is a summary of more of the recommendations which were approved. So we're making improvements to our communications for these carers, so have much clearer guidance, leaflets, websites that explain what the types of caring roles are, what they'll be eligible for, what support will be on offer. We already made updates to our support plans and pre-screening tools. We're clarifying our routes into care and doing lots of work with our practitioners about that. And we're looking to build our support package. It's important to note that we are going to be building that support package over time. So that's something that we'll be doing over the next year as we understand from carers what it is that they need. So we'll be working with them and we'll be building the package as we have more evidence of need. So that's something that we'll be able to come and update you about over the coming year. Our plan is that in a year's time, we will make a business case for what the long-term future of this service will look like. So at that point, we'll have an evidence base of what impact have we made so far? Have we increased the number of placements made under special guardianship, for example? Have we increased placement stability? Have we improved the experience of carers and children in their care? So we'll be building that evidence base over the next year, and we'll have that in the business case. So that is the Family and Friends Care project. I'll just wrap up with the last one, and it might be that you have questions about this piece specifically. So the last piece of the Gateway project we started called embedding reunification across the service. So reunification is children returning home to their families. And what we thought was important was to flip our thinking from practitioners thinking, can this child go home periodically? And that's something that we will regularly ask, and it's something that our independent reviewing officers will ask in care plan reviews. Can this child go home? But we want to be more proactive in doing that. We want to ask what needs to happen for this child to go home, so that we're constantly assessing that. At the same time as making sure that the child has the stability within their foster placement, and that's a really difficult balance, and that's something that our practitioners have to juggle all of the time. But we do want to make sure that we're doing everything we can to enable children to go home at the right time. What we found when we were talking to our practitioners about what more we could do and were there any barriers to enabling this to happen, what we found was that we were talking about things that were happening before the child came into care. So the more that we did with the family before the child came into care, the more likely we were to have a successful reunification later down the line. What we also found that was when we spoke to practitioners, the term reunification is often comes with a lot of baggage, and it's often assumed that it happens when a child's been in care for a long period of time and then you'll re-establish any links back with their family. So again, we need to do some work with our practitioners to think about how often a child comes into care with a plan to return home and how we can make sure that that happens. So as you'll see across these three projects, we had a reoccurring theme, and that theme was of the importance of the wider family network, the importance of engaging that family network earlier, maintaining that family network and continuing to work with them even when a child's come into care. And so what we decided to do was set up a next piece of work called Family Connections. That's being led by my colleagues now in the service development team. And this is really about making sure our practitioners have the confidence, have the skills and the resources to do this wider family network work, do it consistently, and make sure that it's happening from the beginning of our contact with families before a child comes into care, all the way through coming into care, and for those that can return home, continuing that work. So there's a lot of resources there you'll see on the screen that we're looking to put together. We're going to be improving our key messages and our learning objectives for staff. We're going to be putting together more guidance for staff on how to work in this way and updating our training pack. So that work is just beginning, but it's really something that we'll be embedding over the next year or so. And I just did want to summarise as well with the role of the Corporate Parenting Board. It's really important for you to be aware of this work, important for you to be aware of our desire to work with wider family networks and for children to be able to return home when that's possible. But it's not just a local authority responsibility, it's also our partners, whether that's in housing, whether it's access to mental health support services. All of those services will be required to enable a family to welcome their child home. So that's why it's particularly important for you to be aware of this. I've skipped through a lot of detail in those three projects. I could spend an hour on each of them, but please feel free to ask questions about any of them, and I can pick that up.
Thank you, Sarah. That's really helpful. I can't see any hands at the moment, but I'll just give people a couple of seconds to raise their hand. Two have gone up pretty quickly. Councillor Wade was first, then I'll go to Councillor Hare. Councillor Wade.
Thank you, Councillor North. Yeah, it's an interesting report, and I understand why the authorities moving to try and keep as many children in the family or the larger family. The problem is, having had experience of speaking to social workers over the years at the time, and I understand they get into situations with heavy caseloads and there's a lot of pressure because we have increasing demand, and demand is still there unless it's different to how it's been. You said something that actually, and it's not a criticism of you saying it, but the culture behind it. What needs to happen for the child to go back to the family? Now, clearly, there are some young people that need to be put outside the family for their own safety, because the families may have a level of dysfunctionality that will not support the young people with their complex needs. And my concern is that in a pressurised environment, which does come, and I know the fantastic work that children's services do at all levels, looking for the care of the young people is paramount, and no doubt that at all. But there is a lot of pressure at times, especially with, I've seen what the case workload is sometimes of social workers, that the drive to this new initiative, which I can understand where you're coming from, and we've got reduced funding and the pressure's greater. How do we make sure the need for it to happen doesn't overcome the need for it not to happen? You understand the question? And I know you've sort of you've put things in there, but I'm taking it to the next level to challenge it. I wonder if you could answer that, please.
Perhaps if I start and then I'll bring Sarah in, because I'm going to disagree with one of your points, Councillor Wade. You talked about huge pressures and around demand and caseloads, and I'd go back to my earlier point that generally caseloads are the lowest they've been in Hampshire because of the investment in children's services. So I don't, we no longer accept that a reason for not doing something in terms of positive continuous improvement is capacity, because we have capacity to do it. And the short answer is leadership. That's the short answer to your question, which is how are we going to make sure this happens, is leadership. What you're seeing in some of the slides that have just gone before is pushing at the boundaries here. This is not about doing something we should be doing. This is about taking it to the next level. This really is, you know, some of this work, I'd be most surprised if you saw any of this work happening elsewhere in the country. This is us really challenging thinking and behaviour to continue to improve things for vulnerable children. This is not, so it's not driven by capacity, and capacity won't be a blockage to it. Sarah, you may obviously want to add something to that.
I think, you know, as well as the leadership, it's clarity of messages for our staff. So they do have a lot of information that they're dealing with all the time. So we have to be really clear about what our priorities are and the ways of working that we're wanting to promote. So part of that is a cultural change. So with the Hampshire approach being introduced in 2018, we knew that that was going to be that we have to keep reinforcing those messages, keep embedding, keep modelling that way of working. And similarly, with this piece of work, we're going to have to do the same thing. So being really clear with our practitioners, but actually having spoken to practitioners from across the service, so from those that work with families when a child is brought into care, who have a very particular experience of working with that family. And then we're also working with our KIC teams, so those that support children when they've been brought into care. They all know what needs to happen to enable reunification. They all know when it looks good. They all know what the barriers are. And it's our job to remove as many of those barriers as possible. So whether it's streamlining our processes to make it simple, whether it's updating our forms so we've got the right prompts, the right questions. So we need to do everything that we can to remove those barriers, to enable those social workers to do the things that they know work.
Can I just come back with 2 quick points? I totally understand what you're saying, and the needs of the child is paramount, and I think everybody agrees that. And I know, as Stuart says, demand isn't big at the moment, that's fine, but we don't know what it's going to happen in the future. And what I'm saying is processes must be sustainable and resolute, even if the environment changes. Because in the past, and please correct me if I'm wrong, we have had social workers with high caseloads, and we have had a lot of pressure on the individual. We may not, perhaps not at this moment in time, but it's happened in the past. All I'm saying is that we need to build into this initiative the ability that when things aren't as smooth as they are now, because you can't guarantee, because the situation with local government funding doesn't seem to be getting any better, can only get worse, and that will produce extra pressures, that we always put that we never come to that point. Mm-hmm. Do you understand what I'm saying? Well, and I know you're sort of looking at areas to protect it, and I totally understand where you're coming from, and that's fine. But we must always put in that safeguard that the pressure to make it happen is never greater than the need should it happen, if you can understand my point. Thank you.
Do you want to come back on that, Sarah, or shall I move on to the next councillor?
I have nothing more to add. Hopefully I was able to answer.
Okay, fine, thank you. I've got Councillor Hare and then Councillor Adams-King. Councillor Hare.
Thank you, Councillor North. Thank you, Sarah. I really welcome this report, and I think it's very, very positive. Just one clarifications for me, if it's okay, is if a child is put in place with a family or friends, the package of support, will it be ongoing? If it's long-term process, will it be ongoing, or will it relax after a little while once everything seems okay, or is this is it going to be consistent?
I'll answer, and Laura or Stuart may want to jump in just to provide some more detail. But it will depend how they're placed with the child. So it depends whether that carer became a foster carer or as a special guardian. But we would put, for a special guardian, for example, we would have a support plan in place which details what support's on offer, and that may be reviewed as the situation changes. But what we're looking to do is provide more support for our special guardians, so to be able to for them to be able to access more support that's comparable to our foster carers. So it will really depend on the circumstances.
And the only thing I would add to that is if it's special guardianship, so child isn't looked after, they're being cared for, yes, we would support as needed. But there is the right question, I think, that social workers and managers are asking is, for how long does the state need to intervene? We should not be as interventionist for the sake of it. It has to be to meet a need. And that, I think, again, we're talking about a change in culture around children's social care here, so that we get involved, we offer support, and then we end that support when it's right to do so.
Thank you.
Nick.
Yeah, actually, Stuart, that leads really well into the question I wanted to ask, which kind of comes back to what I was talking about earlier about, what has it been that has inhibited you using special guardianship as a route out of care for children? And obviously what we want to do is to get them, if there is an opportunity for them to be placed back in the family in a safe environment, and one where the state isn't intervening, then that's absolutely the outcome that is going to be best. And I'm sorry to come back to my favourite topic, but it just kind of struck me that there's an awful lot of commonality between the kind of support that SGO carers will need alongside adopters. And I wondered obviously they can equally apply to the Adoption Support Fund for support. And I just wondered where that aligns with Adopt South, or do you have a critical mass that you can almost have a parallel service of support for the SGO carers, or how does that look in terms of matching the two up together?
Very good question, Councillor. I've had early discussions with Rachel, who is our head of our regional adoption agency, for members that don't know her, Rachel Reynolds, about actually the RAA delivering that SGO offer. It makes perfect sense. But of course, it makes perfect sense to me from a Hampshire and an Isle of Wight perspective. It may not make sense for Southampton and Portsmouth, and so those are some of the discussions that would need to take place. But I'm very open to it being the support being offered by the RAA. There's such a symbiosis with that. It just seems to make perfect sense. So we're certainly exploring it. In the meantime, I think what we're doing, as Sarah has said, is sort of changing our culture and our ways of doing things in the meantime to further promote the use of special guardianship.
Super, thanks.
Perfect. I don't see any other hands. If anyone's got any quick points they want to make, please just unmute themselves and speak. If not, then I think I summed it up at the end of the last presentation. Obviously, we've got the 4 recommendations. I'm not hearing any comment that we shouldn't support any of them or to add any further. Obviously, we just need to note them. And as Steve said earlier, we'll have a brief covering report at the next meeting just to formally adopt those recommendations. I think, therefore, I can go on to the next item then, as there's no hands up, which is item 6, and that's the annual report from Health.
Thank you, Chair. And I'm going to hand over to Dorothy, who will introduce herself and talk you through the report.
Hi, I'm Dorothy Kakari-Boateng, interim designated nurse for looked after children in Hampshire. I'm on the call with my colleague, Dr. Melissa Phillips. Yes, the report. 2021 annual report. The report 2020 has been very, very challenging for health service, as we all do know that with the COVID. So it has affected the level of service that we could provide within that time frame, because at one point we couldn't do any visits at all, and then it became virtual, and then so as the story goes on, that at the moment we are still within the COVID period, but with our review, our initial health assessment within Hampshire, it's done by our GP specialists who do the assessments. And because of the COVID restrictions, they couldn't do some of the assessments. So it became virtual. And then when it was virtual, the nurses were asked to do some of the assessment as well within that period, between March and September period 2020. And there are about 60 initial health assessments that were done by the nurses that we are about to be appointing them to be seen as review assessment by doctors. But by virtue of our lack of enough doctors, we are having to sort of do them stage by stage. So we haven't been able to clear the 60 that were done initially by the nurses during the early part of the COVID time. Some of the issues we've had is lack of capacity. Some of it has been that sometimes appointments are cancelled within short time, and so we miss appointments. And as GPs appointments, they have to tell us when they have got the time. So when you miss 3 or 4 continuous appointments, it really affects how much the service can do within a certain time. When we look at review assessment equally, with our review assessments, we have had challenges with our review assessments equally because we were doing virtual, and now some services, I think Hampshire Hospital has started to do face-to-face assessments, but not all services have returned to face-to-face. And nationally, review assessment has been reported to NHSE with regards to places refusing to do other children from other areas assessments. So that has also affected our level of assessment that we are able to do. But in-house, what we are trying to do is that we are trying to check with the providers on a weekly basis to see whether they have got referrals come in that they haven't actually been able to meet the need of. And I know that from Hampshire Hospital, they have not had any such thing. I know that with Southern Health, they said they have got 2 weeks time. 2 weeks, sometimes people will have to wait for 2 weeks before they appoint. We do also have a backlog, which I think you all can see on the system, that 461 children who assessment has not been done. To date, I don't know where the backlog has started from and how we are in this position. We are looking into it because it shouldn't be that we should be running a backlog and for us not knowing it until now. So we are looking into how this came about. The other challenge that we want to talk about is the adult medicals. Adult medicals for prospective adopters. tends to be a challenge within our service. And at the moment, we are looking into that in making sure that that happens, because we want our prospective foster carers to get the assessment in time so that it doesn't fall, their application doesn't fall through. CAMS has been talked about already, and CAMS, our issue is not about the children that meet the threshold. It's more about those who don't meet the threshold and what services that we can put in place to support those children so that they don't end up needing even the CAMS, meeting the CAMS threshold at all. So we are looking into that and working with CAMS in finding ways that we can try and meet the needs of our children with regards to emotional health. And as Laura has already pointed out, that a third of the children on our caseload has got some form of emotional health needs. So we are working with CAMS to address that. In the report, there's mention about children with mild and moderate disabilities. And that also is being looked at, because before, the service spec did not include those children in the service spec. So children with mild to moderate disability had to see their GPs for their health assessment. But subsequently, we've realized that some of the health assessment that comes back within the service isn't good enough, and it doesn't cover all the elements that we want to be covered. So that's what we've put in place now, that we are auditing every report that comes in and asking GPs to do more work on it as from this time on. But we are hoping that as we can, as NHS comes back to say that contracts can be changed, we can do contract changes to make sure that those children are fully cited in the service specification so that we can monitor their health properly. There's mention about staff capacity in the report. And yes, I think I said something about hidden harm, because there's been only one lack nurse within the CCG for a long time. And that prevent that lack nurse being able to know for sure the children within the caseload. So now it's been ratified by the CCG has appointed a full-time lack nurse, and they have gone out only last week, I think last week or two, looking for another lack nurse to work on the caseload, because we raised that as a risk to the CCG, that they need to sort of have enough staff to cover the caseload of looked after children that we have got. In terms of capacity too, with the initial health assessment, we mentioned that as a risk, and we're saying that we've gone out to, in a way, advertise for more GPs to join the service. And there's planned training and also sessions that we are going to have in the summer, and that we are from July onwards trying to sort of contact. And my colleague who is on the call with me has started, Dr. Phillips has started contacting the GPs individually and having a chat with them as to get them to come on and try and help us, because at the moment we've got only 13 GPs, specialist GPs, doing health assessment within Hampshire, and that's not enough. So we need more people. So that's what we've been doing. We have been on the positive. I've talked about the things that we have not been able to do. And I think that things that we've been able to do is that we have contributed, and I think Ashley will do her report later about the rapid improvement program. We've worked in hand with children's services, looking at how we can improve assessment within the health assessment, improve how they request for the assessment. And our on our part to how we respond to those assessments so that it will meet the needs of the children without delaying the assessment, because at the moment we tend to delay the assessment for quite some time because there is, oh, this form did not come, we need it before we start. Oh, you tell the social worker tells the carer tells social worker tells the health. So that all is going to be looked at, and we are working with Children's Services under the Rapid Improvement Scheme to address that issue. We are working with Children's Services as well, looking at care leavers passport, which actually we'll talk about. And we are looking at leaflets as well. And we've done the adult leaflet. We're waiting to get the children leaflet, just to explain to the children themselves and young people themselves why health assessment is important for them. And also there is training also package that Dr. Phillips has already done a voiceover to train social workers and carers about the importance of having the health assessment done, because often we do get a lot of cancellation from carers who will say that they don't want to bring their child for assessment. So perhaps if they do understand the importance of the health assessment, then that will not be such a problem for them bringing their children into the service. And the leaflet is also to explain to the young person in their own language, in their own terms, what the assessment is meant for, so that they can understand why they have to come for the assessment. I've already mentioned that we are going to work with the disability team and the children team to make sure that all the children with mild disability are cited within our service. So that's what we are doing. We are working with the provider service also in delivering health promotion bits to the assessment, because at the moment it feels like we go in to do assessment and we pull back, and we don't deliver any health promotion, sexual health, drug and alcohol. We don't deliver any of those services. So we are looking at the provider services to try and work with them to offer those services, even if it's signposting the young people to the right service, so that the service will be a complete service instead of young people being lost. Sometimes they use services wrongly because we have not been able to engage with them to signpost them to the right areas where they can get the right support. So I think I will end here and wait for questions, please.
Thank you, Dorothy. That's helpful. And just to draw members' attention to the report, the recommendation is for the Corporate Parenting Board to note the work plan. Dorothy, it's quite concerning to hear in your presentation the backlog of health assessments, and understand what you say about the capacity issues that you're trying to solve and in relation to streamlining. But I just wondered, Stuart, potentially whether there's any Hampshire County Council officer comment on this and the impact it's having on our services?
From a children's services perspective, it has been problematic. I make no bones about it. What Dorothy referred to was a rapid improvement event which occurred, forgive me, Dorothy, I think it was probably September, October last year, may even have been earlier last year. There was a lot of work that went on with the rapid improvement event, with people locked in a room for 4 days to unpick all of this. And unfortunately, what we came out of it, we had a very good work programme. Unfortunately, there were some delays with the CCG in picking that up, and we have escalated that with the CCG. What that's meant is that the rapid improvements haven't been as rapid as we had hoped from a children's services perspective. That said, I am confident things are now back on track.
Thanks, Stuart. And this might not be a question that you can answer, or maybe I point this to Dorothy, but you mentioned there, obviously not as rapid as we hope, but do we have any timescale for when this backlog is going to be cleared?
The backlog was identified, I think, a month ago, and I've put in an options paper, and I'm waiting. I'm told that they have allocated money to us clearing the backlog. I've put in the options paper and waiting to hear. But I think that with the number of children that we have got up to about 6 months to clear that backlog. Yeah.
Okay, thank you. Councillor Wade and then Councillor Adams-King.
Thank you, Chairman. And this is quite a worrying report, really. I've got a couple of questions, really. If you take 6 months, Geoffrey might be able to answer the first one. You might be able to answer both of them, actually. If it takes 6 months to get over the backlog, how do we keep on top of the current demand? You know, during that 6 months, more children will be needed. Are we just going to reduce the rather than get over it, are we just going to reduce it gradually, or are we going to actually kill the backlog as well as doing the day-to-day needs of the service? That's the first question. Would you like me to answer that, and then I'll ask my second?
Yes, please.
Okay.
The backlog, that's why I've done the options paper, because I don't think that it will be helpful if we put it on the back of the providers to do that. It's going to take a long time. And therefore, to me, I feel that we've got to have another way of delivering and looking at the backlog away from the provider services and making sure that we get it done within the time frame that we are talking about. So the idea is that we are not going to put it on top of what is coming in, because we don't want to create another backlog. When we clear this, there's another backlog. So yes, we are thinking of doing that away from the provider services. Yeah.
So it's quite a challenge. Well, my second question is...
Sorry, Councillor Wade. Ashley Burton just raised their hand, I think when Dorothy was speaking, so I don't know if she just wants to add anything to the answer you just received before you ask your next question. Ashley?
Yeah, just very quickly, I thought it might be helpful to elaborate when we discuss the backlog. That consists of both young people in need of initial health assessments, which must be completed by a doctor when these children in care first come into care, and also review health assessments, which are required either once every 6 months for children aged under 5 and once every year for children aged over 5. So the only point that it's helpful to note with that is that as part of the backlog for review health assessments, that will also be covering their future health assessments, so that it's part of those ongoing assessments as part of that work. So it's slightly smaller and not going to create as much burden on future work, apart from the initials, which will be a significant hump to get over.
Okay, thank you. But my second question is a lot simpler, actually. In the report, it says that there are 1,696 Hampshire children and 1,217 other local authority children placed in Hampshire. Are that 1,217 other local authority from Southampton and Portsmouth, not Hampshire County Council employees? Are they from out of area authorities?
Yeah, we do have quite a number of children from out of area who, some of them may be Southampton and Portsmouth, but most of them, they come from further away from this area. So yes, we do have quite a number, over 1,000 of them. Yeah.
So this obviously is going to be an even bigger challenge. Okay, thank you. This sounds like CAMS all over again, really.
Thank you, Councillor Wade. Councillor Adams-King?
Yeah, I'm sorry, Dorothy. I just want to come back to the health assessments again.
Yeah.
You were talking about adopters and foster carers, and that there was. You talked about those health assessments in the general kind of backlog of health assessments bit. Do adopters and foster carers have to come to particular practitioners within the process, or can they just go to their local GP to get their health assessment completed?
Alyssa,
Do you want me to answer this? Because
Yeah,
I've been
please.
dealing with it. So for the adoption, for the adult medicals for prospective adopters and foster carers, that they go to their own GP, but because their GP services, well, for some they've been setting up the vaccine programme, and for others early on, there was just so much demand they weren't providing kind of medicals. And I think because at the start of the pandemic, perhaps people didn't think it was going to last so long, that they thought the work could be shifted along, and then obviously it's created a bit of a backlog. But actually the Royal College of General Practitioners and the BMA have issued a statement recently, well in March, asking that this work can restart. And so part of what we've been doing is phoning and liaising with their safeguarding leads. And actually, when we've spoken to individual practices, we've had a really good response, and they're trying to expedite, but there is still a backlog. So some practices, the wait might be 6 weeks, but we still feel it's the safest way to do it because those practices know those patients rather than sort of commissioning an additional service.
Yeah, I've heard stories of people having their health assessments done in car parks and so on.
Well, they have Coram back have
at least they've been done, which is the main thing, which has been great. And the foster carers, do they come into the same category? Because I mean, if we're looking to recruit foster carers, the more that we have in house, the better, rather than going to IFAs, I assume. So.
Yeah, so the foster care medical is also done by their own GPs.
Same process, yeah.
Same process, and actually at the moment it can all be done virtually. So they've replaced the examination with a kind of systems inquiry, and only if you have concerns do you need to examine, because it's very unlikely if you've got the whole health history and you've done the interview that you're going to find anything on examination that you haven't been flagged to in some way prior to that. So it has made it a little bit easier for GPs, although I think a lot of GPs are now happier to see people face to face if needed.
That's helpful, thank you. The other question I had, I'm not sure whether any of my councillor colleagues have been receiving them, but I'm beginning to get sort of emails and some social media comment around the review of public health budgets that we're looking at. And something, Dorothy, that interested me was the way you were talking about reviewing your processes so that you can become perhaps more proactive and more involved with certainly older children. And I wondered, I suppose this is more of a general question to say, is there some commonality there, and is there some alignment between what you're doing and what public health are doing by way of providing support to case conferences and to children, for children in care that can help with that process of looking at how we either stop duplication or we make things more streamlined and more straightforward across the two different public bodies, the social care and health.
Yeah, at the moment there's a lot of work going on, working with public health and us, and we are trying not to duplicate things so much, especially with transitional care, for instance. So all the discussions that's happened has been CCG and public health meeting to sort of look at how best that transition can happen. So so we are trying, but as the NHS goes, things tend to take a long time before you can see. Yeah.
That's super, thank you.
Does any of the county council officers want to make a comment on that? I mean, you referenced that consultation, Councillor Adams-King. I fired an email off to Graham Allen last night about it. Stuart, I don't know if you want to make any comment.
My comment is entirely selfish, which is as long as the right health professional is at a case conference around child protection matters, as long as the right health professional is having input with our children in care and our care leavers, then that's for public health and the CCG to come to an agreement on. So quite selfish on my part, and probably rightly so.
Thank you. Councillor Hare?
Thank you, Councillor North. Sorry, it's me again. Dorothy, I'm really concerned about this report, as are other councillors, and especially about the backlog. I know we've all spoken about the backlog. Obviously, it was unpleasant surprise for you to find out that there was suddenly this backlog which you don't really have an explanation for. Going forward, is it possible that we can have an update on, or the corporate parenting board can have an update later on our next, or the meeting after, to see how you've actually actioned this?
Yeah, it will be very good, because I have actually initiated that within Children's Services, that we have to work together to find out how this backlog came about, because unless we can actually identify how this backlog came about, we are bound to have the backlog again. So there's got to be root cause analysis done properly, so that we will know how we came to amass this number of children without assessment, so that next time we will not get there. And we are at the moment, we are having like 2 weekly meetings with Laura and Ashley, for instance, and we talked about it, that we'll bring it at that 2 weekly meetings and look at what, so that we don't build up those backlog within the CCG. Talk with my managers around how best that we manage the backlog now, but also to put something in place so that we can have monthly monitoring of how much assessment is being done. And if there is if request doesn't meet the assessment done, then there's got to be an explanation as to why those assessments did not take place. So we are putting measures in place. So yes, I'll be very happy to report back as to how what we are doing and how far we've gone to. Yeah.
Thank you. And obviously a lot of communication between providers is really important. So, if you can have that on your action plan, and sort of how much of the backlog you've cleared, what sort of figures you have, if you could bring that to the board, that would be really good. Is that okay, Councillor North?
Fine by me, as long as the chairman's in agreement. Ashley's got her hand up as well. I don't know if she wanted to add anything to what Dorothy just said.
Just very briefly today. Unfortunately today we've not had time to run through in any more detail about the joint action plan that we, as they did meet in September last year to look at processes involved in arranging, completing and acting on health assessments. And through that, we identified a series of issues that we believe have contributed to the creation of this backlog. This isn't a brand new backlog, or that has built up over the period of the COVID pandemic. And we have got a joint action plan we're currently working towards to addressing that. There have been issues of the COVID pandemic, structural changes that have delayed implementation of that, but I'm sure that we can update on the progress of both that action plan and to addressing the backlog and addressing that in future. Obviously, can't go into more detail today, as I know there's also a report from the police.
I think that would be really helpful. Thanks, Ashley. Councillor Wade, you just put your hand up again. You've had one bite of the cherry, but have another one, and then we'll move on to the next item.
This is just a quick point for us to have a better grasp of the situation. What would be useful if we could get a look at the data over the last number of years and see how this backlog is and where it began, and how, and then we could monitor it, because it's better to make data-based decisions. And it would be useful to look for the data the last 2 to 3 years and find out where the backlog actually started, or has it been something that's gradually been building up, Chairman? That's all, just to help us understand it better.
Thank you. I think health colleagues and officers have noted that, and we'll get something on a future agenda so we can have a further conversation with that data, as you say. Thank you. Has anyone else got any points to make? If not, then I'm going to move on to the last item on our agenda and thank Dorothy. And I can't see any further hands. Ashley, is that a legacy hand from before?
Yes, sorry, I'll put that down.
No problem at all. Okay, then item 7 is the annual report from the police, and Superintendent McManus, I can see you appeared on my screen. Over to you.
Hello, hi everybody. I'm Karen McManus, Superintendent Superintendent of Hampshire County Prevention and Neighbourhoods. So I was asked to, whilst this is an annual report, I was asked to very much base this on sorry, I can just see my ties. Base this on an awful lot of new councillors arriving, and actually a little bit of an update as to the work that goes on in partnership between ourselves and Children's Services and all our other partners. Rhys, I don't know if you've got the document that you can share that I sent in. Do you have?
Would this be the PowerPoint?
Yeah, it is. I mean, I assume everybody has the PowerPoint, and I can talk you through it. We've recently launched. I'm working between two different types of screens, so please excuse me.
That's no problem. If you give me a moment, Superintendent, I can load this up for you and set it up for you, if that would be your preference.
It's up to, if everybody else has got it on screen anyway, then you can flick back and forth as I talk, because as I've started to review it and look at it, it's not kind of in the order that I would put it in describing it now. So I will be flicking back and forth anyway myself. We've recently launched in Hampshire child-centred policing, which is very much working with Children's Services, education, our other partners, in relation to making sure that all of our processes, whether we're dealing with children as victims or witnesses or indeed as offenders, are considered as children first, notwithstanding that they will have been victims of either minor or serious offences, witnesses of minor or serious offences, and the same applies with offenders. And if I give you an example, yesterday I dealt with I was forced custody, and I had to review a child that was in custody for a serious offence. He was 16 years old. It was likely he was going to get bail conditions in relation to the offence that he was, and it's a live investigation, so I won't talk about the detail of it, but within those bail conditions, the offence had happened within the family. But one of the things that I was really keen to ensure happened was that that child would still be able to see his mother within those bail conditions, even though he would probably not be able to see the rest of his family. So that's a kind of example that when we are dealing with children, whether they're dealing with offences or victims, we will make sure that we consider them as children. So this young boy was going to be bailed very probably, but within that he was going to still have access and be able to speak to his mother, which for an offender who was over 25, because the offence had happened in the family, that wouldn't have normally been the case. So our child-centred policing is very much to treat children as children. Every interaction is an opportunity, and also we're very aware that actually when the police arrive at your door, whether we're there to be nice or to arrest or to deal with an offence, you don't phone us on a good day and things are not going to be going well in your life. And so we're very much aware that we actually have to treat children gently and carefully. And the other really important thing for us is that we have the voice of the child is very much within our public protection notice, and that we send as Children's Services, and we do listen to the voice of the child. So if you can move on to the next slide, please, Rhys. Thank you. So when I was looking, starting to prep this, and I did think, what would counsellors in charge of corporate parenting want to know? So the Met team is our missing and exploited trafficked team, and so I asked whether we would have details of our LAC children, and whether they're at risk of CCE, which is child criminal exploitation or child sexual exploitation. The number of deployments that we have to residential homes or children with foster placements, the number of LAC children brought into custody or arrested or voluntary interviewed, and the number of public protection notices that we have submitted on LAC children. We don't have that data. We do not capture that data in that way, and so it was not easy for us to, there is no easy way for us to find that data out. But I will tell you anecdotally that quite frequently our residential homes are repeat locations for us within districts. Because of that, because we attend residential accommodation more frequently than we would attend a normal home environment, we are at risk of putting children into the criminal process unnecessarily. So because of that, and I will bring this back to you at another time because it's still in pilot. There's a Philomena protocol that has been established in that's being piloted in the Forest. We're going to be evaluating that. It's being run very much by our Protecting Vulnerable People team, and it is about improving our collaboration, working with children's services and with residential care homes so that we can reduce unnecessary calls to the police if there's a breach of curfew. So if a child's late home and it's your child, you do some phoning around and you will make some phone calls, and you, if you're like me, notwithstanding they're 20 and 22, you will check where they are on Find My iPhone, etc. But actually what we were finding is that sometimes we were getting phone calls for children being late as opposed to being missing. So we're doing some work, some partnership work, and this has all been gone through the Children's Safeguarding Group that to try and reduce the number of calls to care homes, which will reduce our interaction with children, which will reduce the possibility of disproportionately criminalising looked after children. So so that's a protocol that's just in its infancy at the moment, and we will be working through that. And I think it's important I bring that back to you with some data, because we will have some data around that then that I will be able to give you in relation to that. So Reese, if you could go on to the next slide, please. Lovely, thank you. So this is information that we've given out to all our teams, that actually when you're dealing with children, these are the three things to think about. Treat children as children first, to think about the voice of the child. Every action is an opportunity. And that when we are dealing with children, that actually we assess the risk and we assess it again and again if we're working with them over a period of time, that we share information with our partners, and we've got some really good strong examples in Hampshire of sharing information well, up in Basingstoke. And our councillors from Basingstoke will recognise the issues we've had around the Basingstoke street gang, and the really good partnership working we've had there, sharing information. I'm a real dare to share person and make sure that the right people have information to be able to protect children, and also that we deal effectively, expeditiously and quickly with young people and children when we are dealing with them, whether as victims, witnesses, or indeed as offenders. So that's internal information that we've given out, and that's the work that we're working towards in terms of what we're trying to achieve with children in our that come into our notice in different ways. I'm not saying it's landing easily and quickly, because we are under a lot of pressures with all the bits and pieces of work that we're dealing with, but this is very much our focus. HMIC, FRS, which are our inspectorate, they are aware of what we're trying to achieve, and we've just been had them in on inspection, so they will give us a grading, and I'll be happy to talk through that grading as well with you when we get that out. I'm not sure of the dates of that. And I think, oh, there's one more slide which just shows you the end-to-end processes of children in the criminal justice system and actually what we do around that. But each one of those areas, those are all the things that we consider. The words RUI means released under investigation, which is one stage down from bail. We don't give conditions in relation to that. And the HLDS are the Hampshire Liaison Diversion Scheme. I always want to call them a service, but they're a scheme. So those are the those acronyms for you. But that's just the process that we work to when we're dealing with young people and children. And I think those are all of my slides. And I appreciate that's a real whistle-stop tour, but it's a briefing for you, so you've got a better idea of how we work. We work really closely with our partners, and I think we do have a good, robust relationship, which is reassuring for you, I hope.
Thank you, Superintendent. Are there
Karen,
any questions?
please.
Thank you, Karen. Are there any questions from members? Councillor Wade.
Thank you, Councillor North. Yeah. Superintendent Karen, a question, you may or may not be able to answer this. Proportionately, are looked after children who offend at a greater, is their reoffending greater than non-looked after children?
I really wouldn't know the answer to that, because we'd have to really look into the detail in relation to that. Stuart's going to come in here.
Well, if I may, Councillor Wade, because I chair the Hampshire Yacht Board, which is the youth offending team or youth offending service. I also chair it for the Isle of Wight as well. And in both boards, it's surprising that repeat offenders are not looked after children don't dominate in that, and interestingly enough, they don't in terms of first-time entrants as well. But a very small number of looked after children are repeat offenders, but not the most, if that makes sense.
Yeah, no, I wasn't thinking it would be a greater cohort, it's just that proportionally. That was the point I was trying to make. That's all. Is it proportionately more or less? But that's all. If you say no, that's fine. That's what. Okay, thank you.
Are there any further questions? I'm sorry, Karen, that you had the final slot, but
that's all right. Don't worry.
I don't have any particular questions either, but your report was very interesting. I'm sure we're here at have another update from you or one of your colleagues at a future meeting.
Yeah, and it's important in terms of the Philomena protocol that will really impact on the corporate parenting board. It's something that our team have worked closely with children's services in relation to, so that we're not disproportionately affecting young people that are vulnerable, that they're are most vulnerable. So it's right we give them extra support, not criminalisation.
No, thank you. That's really helpful. I can't see any other hands up, so as that is the last item, I say thank you to Karen. Councillor Briggs apologises for her technical problems, which meant that you've had me in the chair today. Don't worry, she'll be back in the chair for our next meeting. Hopefully that will be in person. And that is the end of the meeting. Thank you so much.